You know, you, especially you being a doctor that's also a believer. I remember when I was going through treatment and I was having my thyroid monitored also because there were areas that were lighting up on the thyroid area. So I have a multinodular thyroid. Um, and so I went in to see this ENT surgeon, and she was a Muslim woman. And she told me something that I'd never seen in research. But I really felt good to hear those words that she told me. She told me, oh, are you a religious person? I said, yeah, I'm a Christian. And she said, oh, okay. So I want to tell you something. That research has found that religious people who believe in a higher power and are diagnosed with cancer, they tend to survive longer. So that is what she told me, but she did not tell me what the research study was, so I could go look for it. I think I should start hunting for that study. But have you heard of that study, or Africa being a very religious society, Kenya being a very religious society? Do you think there is a part that religion plays in recovery or in the journey through cancer?
I think so, and I think the reason I don't know about the study, I haven't had, but that's really interesting. I definitely like to look into that. I think the biggest thing that religion does, and like Christianity in particular, is having that belief and having that hope makes a big difference. Because even you talk about contributors to health outcome, mental health and psychosocial well-being is a key factor. And me being a Christian, just like even generally in any kind of thing that you're going through life, just having that foundation that there is hope, and I believe that it'll get better in one way or another, pushes you in ways that other people who don't have that can be able to go through. Because your mental health, you are trying. There are those patients you see who've given up on themselves. And it's so sad because that puts them down even further. Some people really spiral, and I think just advocating for more counseling for conditions like depression and anxiety amongst patients with cancer. I think sometimes we get lost in the routine of chemotherapy, radiotherapy, this and that, but we don't assess those things as keenly as we need to, because I feel like that contributes so much in terms of the progression. Because once you have that mentality that I'm gone, I'm done, you're not willing to try, you're not willing to do the follow-ups, you're not willing to the treatment. Even the treatment itself becomes a bit heavier on you because you're already slumped down. And I think mental health contributes to physical well-being in a big way. And I think that's the way that religion roots us, so that despite how tough things are, you're still pushing, you're still trying. And I think that's what being when I hear the word survivor, for me that means someone who's you've pushed against the odds, you've pushed against the side effects, you've pushed against the community misconceptions, what people are saying about this and that. And so I think that's how it plays a role. Really true.
Now going through my own, the kind of treatment I went through, the doctors really were emphasizing, or let me say my doctor, because she's a Nigerian black woman and I just love her so much. And she told me I was overweight, by the way. I was obese.
Oh wow.
Yes, I was about 200 pounds. And
Wow.
she really emphasized, and she strictly told me, I need you to lose weight. And can you imagine, I'm going through chemotherapy and I'm working out, I'm lifting weights. It was so hard because she wanted this weight to be down by the time chemotherapy was ending, or stopping, because she did not want, in case there are some cancer cells, she did not want especially my tummy belly region, to provide that environment, the fatty environment, for especially the estrogen feeding cells to thrive. Now, I know that many times in some areas, they only, like you said, focus on chemo, radio. Do you do you guys look at, the physical, the working out, and then again the nutrition side? Because in speaking with some patients in Kenya and in other parts, even in the US, I have my friend here, Dollar Bills. Dollar Bills is right here in Dallas, Texas. But Dollar Bills was relying on my experience at MD Anderson to get to know what to eat.
Yeah.
Because at MD Anderson, really emphasize on don't eat this, we need you to eat this, because they have oncology nutritionists, you know. But Dollar Bill's team was telling her, just eat anything. If that thing is to come back, it will come back whether you're eating healthy. You know, so this was confusing her. So what are your thoughts on nutrition and, you know, fitness, you know, leanness? And is this something, a message that you also see doctors or oncologists sharing with patients in Kenya?
Yeah. I think that, as you've said, those are the key elements that we tend to kind of sideline, which are really important. I'm actually quite honored because where I work, we have a nutritionist who does such a good job. She talks to the patients when they're going through chemotherapy in the chemotherapy center. We consult her in the clinic, because if there's a question I've had so frequently from patients is, Daktari, what should I not eat? And they're always saying, I've been told here I shouldn't take milk, I shouldn't take tea leaves, I shouldn't take sugar, I shouldn't take this. And then we have people who come from certain communities where you're telling them no meat, and they're like, what are you telling what are you telling me not to eat? You know, these communities where their diet is milk and meat. So I think it's really important to have that nutritional aspect. I personally try to involve that a bit when I'm talking to the patient, and get the nutritionist to see the patient as well. I think, as you've said, the most of the time we also have a challenge with most patients on treatment. They don't have appetite, they don't want to eat, or they have side effects like vomiting. Then you find the ones who get like the peg tube in the stomach. A lot of people don't know which kind of nutrition to give patients who have the tube. So you find all they're pumping is fruits and milk. So this person never gets anything else besides fruit and milk. So that's why we try to involve the nutritionist a lot, because those are areas that you find blank. For all patients who we see in the clinic, we normally have their weight and their height and their BMI, so that we're able to assess the nutritional parameters as well. And you find such things like, even things like, if you're not optimally doing exercise, we find patients who come and they're having like this swelling of the lower legs, because most of the time people believe when you're on treatment you shouldn't do anything. So all they're doing is sleeping and waking up and that. So there's no physical activity happening, and you start getting such effects, the swelling. You find people whose pressures are all over the place because of the same thing. So I think it's important to factor that in, and I think it'd be really beautiful to be able to get insights from you, even in our facility, in terms of just nutritional advice, especially in those different settings for patients who have the tube, for patients who don't have appetite. It would be really helpful. But our nutritionist is doing a good job in terms of breaking that down. It's just that people will come for treatment and they'll hear, I was with this one and she told me that I shouldn't eat this. So it just becomes like, okay, what are you eating? Yeah.
They can even tell you water is not good. You know,
Yes.
you are left. You will not eat anything. You
Anything.
know,
Yeah.
I like
Exactly.
what you've said. You know, coming together and collaborating in this, and I'm willing to do that. And like I mentioned for you, once I'm done with my course,
Yeah.
there are certain protein powders that I use even now. You know, after I work out or in the morning when I make my smoothie, I use them, because many times, and even here at the hospital, whenever we go through chemo, the smoothies and the protein powders that they will quickly recommend, they have dairy in them. But the oncology nutritionist is telling you, you know, and then that's what I tell people. The the doctor himself or herself will not be in that place to tell you about food. That's not what they've
Yeah.
been trained. Their work
Exactly.
is to look at these cancer cells and how to treat you and go, and another patient comes in. So that
Yeah.
missing link for several hospitals and oncology departments is the nutritionist. And I'm
Yeah.
so glad to hear that you guys have your own, you know. So it is the nutritionist that sometimes the doctors could tell me, take this, the nutritionist said, because they've studied oncology nutrition, you know.
Yeah,
And
for
so
sure.
I'll be willing to share this, and I can carry some samples with me when I come. So I bring to you guys, we see if there's a way in which they can be produced within Kenya. And if that's
Yeah.
not possible, we see how to ship in, because they don't have any dairy in them. They're all vegan. I will take dengu, mung beans,
Mm-hmm.
very high in protein. Just one
Yeah.
scoop, I already have like almost 30 grams of protein in me.
Uh-huh. Wow.
So
Mm-hmm.
if that is blended, then that is food that can get in to a patient, and it
Yeah.
is a nutritious meal.
Mm.
I went to Eldoret and I was concerned. When I
Mm-hmm.
was talking to patients there, they told me that when they admitted for chemo, the
Mm-hmm.
food that they eat every day is ugali and cabbage.
Oh. Mm-hmm.
And that made me so sad because ugali and cabbage, that's high carbohydrate.
Yeah, for
And
sure.
then there is lack of protein, which is the
Mm.
building block. Because
Yeah.
cancer is killing both the good and the bad cells. It's
Yeah, for
not
sure.
sparing. But
Mm.
now there is no healthy lean protein to help
Yeah.
these good cells in rebuilding. Now
Mm.
it leads me to groups.
Yeah.
Do you have any support groups, or have you seen any around your programming and what you do? Have you seen support groups for patients or for survivors? Because once the
Yeah.
treatment has ended, it's confusion.
Yeah. That's very true. That's very true. I've experienced that a lot. We do have a group. We have a group as for survivors. They've been doing a really good job. And I think I was sharing this with you earlier. Me, as I see a patient and I'm trying to tell them it's gonna be okay, we're going to try to help you and they're working with you. It's very different than if someone who's already going through the journey tells them. And I find it so beautiful because I have patients who come in and they tell me, oh, I met up with so, and they've told me they've been on this and this. And it's so encouraging because you can see they have hope. Someone who came in so scared, so traumatized, they talk to someone else just in the queue to go for chemo or waiting to get their labs done. And they've been able to just make a friend, someone who shares that same experience. So I believe that's the same thing. The group that we have for survivors, they've been working with each other, they've been working with the new patients, and even the solidarity when some of them or one of them passes away, just to encourage one another. I think support groups have made the biggest difference because at the end of the day, no one will understand you like someone who's gone through your journey. No one will. And the bond that you make in that setting can carry you for days, even if it's someone you had nothing at all in common with, came from different backgrounds, studied differently, different communities. I've seen people develop really good friendships as a result of just getting the treatment together. So yeah, we definitely have these support groups present, mostly for breast cancer. But I think the idea is to grow and also get patients to just be able to engage one another more openly and to support one another in the journey.
So
Uh-huh.
I wanted to ask, I know you guys have encountered patients who come in and they don't have funds
Mm-hmm.
for treatment. Do you guys have some kind of, you know, donations or some kind of funding that you give to patients who maybe have maybe 70% of the funds or 50%? Is there a program you guys have or partnership with organizations that can help relieve patients of these costs?
So, unfortunately, not per se, because most of the patients who come, one of the things that I've mentioned before has really been of help is NHIF. So those ones who have an active card, it'll be able to cover that like 70% of what you shared. We've also had patients who've gotten support from like their churches or like separate different groups. So we don't have fixed one per se that's directly tied to the hospital. And I think those are good partnership opportunities to have, just being able to have a group that we can liaise with to be able to support patients in need. Because like we said, I was reading through this and I was seeing that about 1 million Kenyans actually fall below the poverty line because of health related issues. So even by the time we've gotten treatment, we've had patients who sold their land, they've sold their cattle, and at that moment of desperation, there's really only so much you can do. So I think it would be beautiful to be able to partner with organizations or groups who are able to support patients in need financially. So for now, the best we can do is advise on the government funding, and also like give recommendations in case it's needed on our side. We're able to draft letters to request assistance for patients, so that those ones who are able to link up with different groups outside or even churches to support them. We've seen people get help in that way, one way or another. Yeah.
Now, what do you see if you compare public and private hospitals in terms of cancer treatment? What stands
Yeah.
out? Earlier today, we had a social worker from he works with American Cancer Society and liaisons with Kenyatta National Hospital, and he did list some of them. You know, for instance, in the whole of the nation, he was shocked. The whole of Kenya, there's only 2 PET scans,
Yeah.
one at Aga Khan and one at KU.
Yeah,
You
for
know,
sure.
and at KNH, when people are told, okay, we need an MRI, they can take even 3 months to get MRI. The line to get PET scan at KU can take you 6 months. What other things have you observed? Do you feel that even the private sector is suffering? What are in the books? Do you think some of these PET scans will be available in other counties? Because KU and Aga Khan are all in Nairobi. That's just one
Yeah,
county. And we have so many
exactly.
counties. What
Yeah.
is happening?
Yeah, that's such a good point, and that's very true. I've seen patients who've literally come from one place to another because of being tired of waiting for chemotherapy, or the drugs are not available, waiting for radiotherapy, or the machine has broken down, or waiting for queues for the scan. I've appreciated the difference in the private sector because, for example, if you came to see me, where I'm working, and let's say you had your NHIF card, and we did the application for the treatment. Within 1 or 2 days, you get the approval, you start the treatment. NHIF will have started the chemo and the radio. If you need a PET scan, again, NHIF, I'm repeating this a lot and a lot. Anyone who's listening to this and you don't have NHIF, please, it's not 100%, but it's something. With NHIF, we can book for you a PET scan at KU, and you can get it done within a week, and NHIF will cover for you. So it's the biggest difference. Yes, there are only 2 in the country, but because of that interlink, then at least you're able to get that assistance. Again, for the scans, you can do a CT scan or an MRI, NHIF will cover 50 to 70%. It's not everything, but it makes things move faster. So that's why we have a lot of patients coming from the public sector to personally our facility because of that. Because you have lesser delays. Of course, there's some aspects of cost that are a bit more there, here and there ones like the lab test, etc. But in a bigger picture, then things move faster because even just with NHIF, you're able to get the process ongoing. If you need a CT scan, we're able to do the CT scan, etc. So the challenge is there. Like, I think it's very important what you've said, the other counties, because we have patients coming from Machakos, coming from Busia, like from different parts, just for that, especially things like radiotherapy. And I appreciate that these are things that are just coming into the country. I think in as much as we are noticing it as a gap, it also points to the awareness that's there. Because at some point in time, we didn't know we needed these things because we were not aware they were needed. We didn't know PET scans could do these things because we didn't know what PET scans were. But the fact that we are noticing that there's a gap in PET scans means that there's something that's happened that's been introduced here. So even these diagnostic tools, like there was a time there were only x-rays and ultrasounds. You can imagine what the case for cancers were at that point in time. So there's that appreciation that we are being aware of the things that we need to be able to make a difference. And of course, it's not going to just shift in one go, but as I said earlier, appreciate things like what the National Cancer Institute is doing in terms of working with the government also to try to include the diagnostic tools in different counties. I don't know how long it will take for us to get there, but definitely, because even this aspect of nuclear medicine and these advanced radiological tools are just coming into Africa. Like right now we're hearing about targeted therapy drugs that are less toxic than the chemo drugs. They're just getting in and they're so expensive. So we are soon going to start saying, how affordable are these drugs for the patients who need them? But doesn't that mean that we've gotten something that wasn't there before? So I think it's a progressive step. As we get more aware of the need for these things, that means that we actually know that these things can make a difference. So I think just expanding that awareness and being able to champion for more change in these counties would make a big difference. I envision a Kenya whereby we have these resources adequately reaching, and this will happen with more doctors undergoing the training, because we didn't have radiation oncologists before. Now they are there, and they're the ones who are able to do these things, because you need someone who's a nuclear medicine doctor, you need radiation oncologists to be able to operate these tools. Like look at the cyber knife at KU. You need the people who can be able to operate these machines. So the more we are training the doctors to be aware that this is a space that needs to be infiltrated, then we can push for these things to come as well, because now we have the expertise. Because we also need to factor in the technical aspects as we bring them in, being able to equip our people to be able to do them. Like even now at Kenyatta Hospital, University of Nairobi, there's a program for training on radiation oncology. So I believe with all these changes coming about gradually, there is light at the end of the tunnel, because we're being more aware on additional tools that we can use for managing and diagnosing cancer.